So, what? Tell me some of the crazy things you've seen in the ER and the OR.
You're putting me on the spot. There's a lot of
Yes.
things. So, urology covers the gamut of everything from the
Let's talk about the
kidneys.
penis.
Let's talk about the penis because
Yeah.
that's usually the most, that's always the thing that excites the ER the most.
What's
So,
priapism?
priapism is when you have a painful erection lasting more than 4 hours. And
They
then,
actually inject
yes.
something into the
Yeah,
penis.
yeah, yeah. Yeah, yeah. I've seen patients who at like orgies or something do like a multi-drug cocktail, inject themselves with, they don't even know what they're injecting themselves with, but their partner just gives them something to put in their penis.
So they show up in the ER like full rager.
Fully, yes, fully erect. And it's painful because it's been going on for 48 hours.
Can you die from prostate cancer?
Absolutely.
Okay.
30,000 thereabout men die each year in the United States from prostate cancer, which is too many, I think, especially since we have good screening for it. You know what I mean?
Why?
Um,
Why would you call the fire
because
department?
you need to get like a chainsaw, and that's not, no, truly, that's what you have
What?
to do. So you have to call, I
A
think,
chainsaw to put on the penis? Yeah, but chainsaws are massive. I'm
exactly
thinking of.
over the
Have you had
weekend.
to cut off?
Hey everyone, I'm Joe Rotbart and welcome to The Grind and the Glory. This is where we talk about the hustle behind the headlines and real stories behind the success. This is The Grind and the Glory. Now let's go.
A world famous up and coming urologist. She's a robotic surgeon. She's fluent in English and Spanish. She's a girl from the 305. Uh, there's so many things I can say about this guest. I'm excited. This is our first podcast, and she was. I'm humbled enough that she was the first guest to come on our podcast. My name's Joe Rotbart. This is the Glory and the Grind, where we take guests from all walks of life, all personalities. Doesn't matter if you're a surgeon, a lawyer, a doctor, an actor, a musician. Everyone has a story. Everyone has a grind. We're going to talk about that. This is unedited. It's going to be a great conversation, and I'm excited to welcome Dr. Shirin Razdan.
Thank you, Joe. Happy to be here. And I'm
Who are you?
sorry if my phone is going off. I'm actually on call, so this is gonna be interesting, I think.
It's the life of a surgeon. They're
The
always on
life of
call.
a surgeon, yes.
So tell everybody a little bit about yourself.
My name, as Joe so eloquently put over there, is Dr. Shirin Razdan. I'm a urologist, urologic oncologist, robotic surgeon based out of Miami, Florida. I specialize in kidney cancer, prostate cancer, enlarged prostate. I also specialize in prosthetic urology. I did, like, you can think of it as a super specialization in that. So a lot of, erectile dysfunction, penile prosthesis surgery, slings, so on and so forth. And I am, excited to be sort of new to the South Florida area and
Yeah.
provide what I hope is outstanding urologic care to my patients.
Well, you know, I think for the audience out there, surgeons tend to always get very clinical. They speak these big words, erectile dysfunction, that means you can't get it up,
Yeah.
right? So
Yes.
I think for the audience, talk a little more real about, what do you see? Do you see more men? Do you see more women? What are the kind of patients that you see in your
That's a
office?
great question because even though I am like a fellowship trained, oncologist, robotic surgeon.
And tell everybody what it means to be fellowship trained, because I don't
Okay.
think people know that.
Okay, good point. So let's back it up. So 4 years of medical school, that's just to get my medical degree and be a doctor.
Yeah.
After that, I did 5 years of residency, which is specialty specific. I was in New York at Mount Sinai Hospital and I did a urology specific residency. So after those 5 years, I could go ahead and practice urology, general urology. However, I wanted to super specialize. And I was really interested in robotic surgery, especially for, kidney cancer, prostate cancer, and some basic reconstruction like scarring of the ureters, things like that. So I did a 1 year fellowship in robotic surgery, also at
Mm.
Mount Sinai. So the long and the short of it is I'm, trained as a gender neutral, so to speak, oncologist,
Mhm.
robotic surgeon. But since coming to Miami, I'm not gonna lie, most of my patients are women. I get a lot of women seeing me for recurrent UTIs, urinary incontinence, and a lot of chronic cystitis. A lot of, I don't know who's been telling these patients this, but every woman comes to me and says, Yo tengo cistitis. We're in Miami, so there's a lot of
Right.
Espanol.
And cystitis, just so everybody knows,
Self-diagnosed, mind you. They tell
yeah,
me, I don't
that's the bladder.
yeah,
Yeah.
it's the cystitis refers to an itis of the bladder, which is it doesn't necessarily mean infection. It can be any sort of inflammation.
Right.
Anytime you have an itis, pneumonitis, inflammation of the lungs, pericarditis, inflammation of the lining around the heart. Cystitis is inflammation of the bladder. But every woman that comes to see me has already diagnosed themselves with a cystitis.
Well,
So it's almost like it's endemic. Maybe it's a cultural learned sort of thing. But again, even though I am, a cancer surgeon, a lot of patients I see, maybe it's because I'm, one of the few female urologists practicing here in South Florida, I see a lot of women. Which I'm happy to do because I know how to treat that as well. Again, 5 years urology, I cover everything. Probably the only thing that I can't treat is male infertility. But I can do, recurrent UTIs, I can do incontinence, erectile dysfunction, stones. So I'm happy to treat everything. Um,
talk about what it's like being a female urologist,
a female. So
because most urologists are men, if I'm
yeah.
not mistaken, right?
So it's interesting that you say that because historically, yes, and I do think bulk of currently practicing urologists are men, but I can very proudly say in my graduating class, so there were 5 residents who graduated with me, 3 out of the 5 were women. So I'd like to say ours was the best graduating class from Mount Sinai. But recent statistics for residency match rates, graduation rates, the tide has sort of shifted. Now there's a lot more women going into urology
Right.
and graduating from urology residency
Well,
programs.
I have to say this. I'll never forget. We were at the American Urology
Yeah.
Association, and you got picked for one of those debates, and
Yes.
there was this guy that went up against you, and
Poor thing.
you fucking destroyed the
Yeah.
guy. The guy just got annihilated. The guy
Yeah.
was up there. He came up all polished, with his script, and you just came in and you just went Miami on him, and you were just like bang, bang, bang.
Bless his heart.
And bless his heart, you destroyed the guy. And everybody was like, I remember we were all there cheering for you. I was like
That
amazed.
was that was a great day for me. Not because I won my debate, which obviously very important, but I had a huge cheering
Yeah.
section. You were there. My chairman was there. I didn't even expect him to come out to watch me debate. A bunch of my co-residents. I think I probably had the most supporters there at the AUA to cheer me on. And I'd like to think I was respectful, which I was, but one thing about me, and to anyone who's had the misfortune of graduating with me or being a classmate of mine, I go hard when it comes to knowing my stuff. Like I will study all the guidelines. I will read the latest, publications. I will follow up, late breaking news on Twitter. The only reason I even got a Twitter is just so I can follow urology Twitter and know what's going on.
So you're intense.
Yeah, I'm intense when it comes to being the best, like, surgeon, urologist, scientist that I can
Were
be.
you always that way
Yes. Yeah,
all your life?
that's why I say, if anyone has had the misfortune of being a classmate of mine, because that goes from, like, elementary school. I was always going hard in the paint.
Why do you think that is?
So I think it comes from my parents, specifically my dad setting that example. And you know my dad.
I do.
There's no one
And
like
he'll be
him.
on here one day,
We need
folks.
to bring him on. There's no one like him.
No
So
one.
no, truly. So first generation immigrants, my parents came here.
Yeah,
They
tell us your story. I want to know your story.
it's a great story of like the American dream, like the
Yeah.
traditional American dream. My parents, both physicians in India, they moved to the United States to, achieve the American dream, better life for not just them, but for me. I moved when I was 1 years old, so no memory of India realistically. So although they were practicing, my dad was a practicing urologist in India. He had to redo residency here. My mom practicing gynecologist, she redid internal medicine residency here while my dad, jumped around from fellowship to fellowship,
Wow.
Boston. Michigan, until he finally matched at University of Miami, Jackson, for his residency. That's how we all ended up moving down here. So he had to do all of that from scratch just so he can be a practicing urologist here. And as I was growing up, I sort of have this indelible memory of him. Uh, my computer in my bedroom, I think I was in elementary or middle school at this point, was the only computer that you could play like discs on. It had
Yeah.
a CD-ROM drive.
Right.
So late at night, I used to watch my dad watch videos of himself doing surgeries. Like he was always trying to improve himself. At night, he could have just, taken it easy.
So that was a
Okay.
generational thing. Even your grandparents were like intense.
I mean, you've met them.
Yeah, yeah,
Yeah. I
yeah,
mean, but
yeah,
my
yeah. But I
grandparents are
haven't
also,
met them.
okay.
I've met them now, and
Okay,
they're
but my
at the
grandparents
end.
are also surgeons. Maybe it's a
Right,
surgeon thing.
right,
Maybe it's a surgeon thing.
right.
I don't know. But yes, my dad's parents, both surgeons. My dad's a surgeon. I'm now a surgeon. But I think seeing that from a young age, like, no excuse for me. If my dad, is starting all over at the age of 40 to be the best urologist, robotic surgeon
Right.
here in South Florida and America, I would say, then what excuse do I have to be lazy, right?
Yeah.
There is none. And my parents were very tough with me. If I got a 95%, I still remember my mom saying, "What happened to the other 5%?" Uh,
Wow. Talk
yes.
talk about that. Talk
Yeah.
about that.
So excellence was always expected of me. And it's not because my parents were, oh, we have to be strict, but they knew my potential. They knew what I was capable of. They knew that I was a smart, student. They knew that I was capable of studying, working hard, and doing all of that. So they never pushed me in something that I was not talented at. I remember I tried to learn how to play the piano in second grade, and after
Yeah,
two,
like why wouldn't you master that if you
I had
became
no interest in it.
uh,
So that was the issue. I enjoyed dancing more. So for after 2 years and not,
yeah.
learning how to
By
play
the way,
piano
she's an amazing dancer. So
back
we'll
in the
talk
day.
about that
We'll
later.
get to that.
Mm, you
You
had
have
to see her at the wedding. It was unbelievable.
you
Let me
have to
tell you.
come to the Diwali show this year. We'll talk about
Oh,
that too.
nice.
It's in November, guys. So I did piano for 2 years in elementary school. Sucked at it, like glorious. It was gloriously bad. But I had an aptitude for dancing, so then my mom put me in dance class, and that was a perfect fit. I was, dedicated student, learning choreography really
Right.
well, practicing. Similarly with academics, my parents saw that I had an aptitude for studying
Hmm.
and learning and accumulating knowledge. So they pushed me. They pushed me really hard with that. And it's important, I think, that they did that from an early age so I could, get good habits. I remember when I got to medical school, ultimately, some of my classmates were like, "Oh, Shirin, why don't you study with us? Why don't we do group study sessions?" And I said right off the bat, no, not because I'm antisocial, even though, maybe I am, but I knew how to study from a very young age. Like, this is what works best for me. This is how I do it.
Who taught you that? Your parents?
No, no, no. I just picked that up on my own.
So you were just
Yeah. But I did see my dad because
right.
again, he's if you think that I am very particular, I'm in constant competition with my dad in that
Yes.
regard because he also was like superstar student. Um
Yeah, he was top of his class too, wasn't he?
top of his class.
Right.
He also got so in residency you have to take annual like in-service exams to make sure that you're actually keeping up with what you need to know in urology. So back when he was a urology resident, in his 4th year of residency, he scored the highest in the nation. He was 100th percentile on his in-service exam. And then mind you, was it 20 years later? I can't do the math, but when I was a PGY4 4th year resident, I also got 100th percentile on my in-service exam. So it's we're like neck and neck when it comes to academics in that
So
regard.
so like and now to like jump off of medicine for a
Yeah.
second, just in my dealings, because I deal with a lot of Indian people. I work with a lot of Indians overseas in New Delhi,
Yeah.
Chandigarh. I've worked with Indians for so many years, and I think that that talks about the whole immigration struggle,
Mhm.
right? And the whole struggle of coming to this country and having to make it, right? But Indians are some of the hardest working people I've
Of
ever met.
course.
What is that about? And
It,
I'm not saying other cultures aren't
no, of
hardworking,
course. It's
but
it's Indians and Indian immigrants especially
like
have
look how Indians have gotten to the
I
top
know.
here in this country.
CEOs of every company.
Right, right.
Yeah, all of the best doctors
I'm not
are
going to say they're
Indian.
taking over, but I'm saying Indians are everywhere, and it's because they're so hardworking. So
And that's what it
what
is.
is
I'm
that?
not going to say that we're naturally gifted, intelligent, this, and that,
Right,
because natural talent can only take you so far.
right.
Like, I would say that, for example, my dad is a gifted surgeon, right? Especially when it comes to the prostate. I call him the prostate whisperer. But he didn't get
The
to where
what?
the prostate whisperer,
Why?
because no one speaks to the prostate like he does.
Right, right.
Yeah,
He
yeah.
is obsessed with the
He is
prostate.
that like he can talk about the prostate for hours. So if you do invite him, be prepared for a lot of prostate talk.
Nah,
No, no,
I'm
no.
not even gonna
You're not
mention the
even gonna
prostate.
no
I'm
talk
gonna
about
go in a
prostate.
different
Yeah.
direction.
But the point is that you can only get so far with talent and intelligence, right? You
Yeah,
have to put in the work.
right.
And that is something that has been ingrained in Indian families, even, back in India from a very early age. You have to work hard. You have to, study well. You have to get good marks, as they say. You need to take these exams. Um, because you want to make sure that you achieve something in life and make it easier for future generations to be successful
I
in
would have
life as
never
well.
survived in an Indian family.
It's tough.
I could
It's
have been the
tough.
loser in the
I'm
family.
not, yeah, yeah, I'm not gonna lie. It's very difficult, especially when if you have siblings, then obviously you're comparing, one to the other.
Right.
But in my case, only child, I'm being compared to like my parents.
Yeah.
Not my mom is also brilliant. She's arguably the most brilliant one of the trio, but you don't really
Your mom is
she
super
is.
smart.
No, no, no. She's inherently a genius. Like she has a fundamental understanding of she's an internist. She works as an ER physician, these days just, because she, shift work is easier as she's getting closer to retirement. But she just understands all things human physiology better than anyone that I know. But she doesn't come across that way like a super genius. She's just like my mom. So
Right.
when people meet the Razdan clan, they see me and my dad as these gung ho, go getting surgeons, and then my mom as, oh, let's gossip, let's have a good time. When in reality, she's probably the smartest one of us all. Like, we know urology really well and we are good surgeons, but anything outside of the pelvis and the retroperitoneum where the kidneys are, we're turning to my mom. Like,
Yeah.
I have a headache. What do I do? I have a cold. What do I do? Any
Right.
family member who has any medical question, I'm referring them to my mom because she's actually the brilliant one, I think. But the work ethic, the intensity when it comes to bettering myself clinically, academically, surgically, I definitely get from my dad. He is he is the most proximal example, right? He's a surgeon, he's a robotic surgeon, he's a urologist.
How do you feel working with your father? Because
It's
it's one thing,
yeah,
you're his daughter,
yeah.
right? You obviously have this amazing residency, you get a
Hmm.
fellowship, you become a surgeon, you
Hmm.
become a urologist just like your father.
Yeah,
Then you join his practice, right?
yeah.
You get married, you start a life,
In between there, yeah.
right? So what is that like?
So working with my father is very interesting. It's like we can trust each other implicitly, right? There's no concern that we're going to let the practice suffer, or we're sort of taking each other's patients, or there's no intrigue there,
Yeah,
right? But he is very old school,
yeah.
okay, and I'm new generation. So the way I approach certain clinical scenarios is very different than what he would do. If I were not his daughter, he would probably explain to me why I am wrong in a certain way, or give suggestions a certain way. But because I am his daughter, he is extra tough with me and is not afraid to tell me I'm an idiot. And
Yeah,
he will
I've
do
heard
that.
that.
And he's been doing that my entire life. He's like, you're wrong, you're you're an idiot, blah 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 blah. And it's okay, I'm used to that. So I think there's definitely a different dynamic in that way.
Yeah.
Again, if I were not his child, and if he disagreed with how I was approaching a certain patient or patient care, he would probably word that a little more delicately or differently. But he knows that I can handle it because I've been handling it for the last 30 odd years of my life.
And then you chose to come back to Miami.
Yeah.
I mean, you could have went anywhere, right?
Yeah, so that was more just where I had a better opportunity. I was looking in both New York and Miami. I don't like moving to too many different places. So I said if I'm going to start working, it's either going to be in New York because I'm already here,
Right.
or Miami because I've got a good support system there. So I interviewed in a couple places in New York. But then I interviewed at Kendall. So I'm primarily based out of HCA Florida Kendall Hospital, met with the CEO, the team there, and they were the one place that really seemed eager to have me. Like they really were trying hard to recruit me. They even got me a single port robot. So there's different types of robots that you can use for robotic surgery. The most traditional one, you have four trocars that kind of come tiny little incisions in the
Mm.
abdomen, and it's like laparoscopy but controlled by a robot. So that's traditional robotic surgery. But in the last couple of years, there's a single port robot where it's just one incision about this big, and you dock the robot, and the arms kind of come out like, that claw machine that you get in an arcade.
Yeah.
That's what it looks like.
Yeah.
So, not many people, if any, really do single port surgery here in South Florida. And that's
You're
some,
one of the only ones, I
yeah,
think.
I think
Yeah.
there's a handful, I would
Yeah.
say, but no more than like I can count on one
And it's
hand.
hard to do. It's not
Yeah,
easy.
because it's again, it's new and I learned it in fellowship. Like it's not something that I did too much of in residency either. So I
Right.
did it in fellowship and I wanted to continue that because I wanted to offer that to my patients. It's a great technology. It avoids everything here in the abdomen. You can go through the back and, attack all sorts of tumors in the kidneys. You can dock directly into the bladder and do surgery, directly in the bladder without affecting any, surrounding anatomy. So incredible technology. And the hospital said, we're going to get that for you. We'll do it. So it was sort of like an offer I couldn't refuse.
Yeah.
And that's how I ended up in Miami.
And yeah, I mean, talk about the grind, right?
Yeah.
So you get to Miami, you
Hmm.
have to start a practice, you're brand new.
Yeah.
Nobody knows you.
They know my dad.
Right.
And you would think that would help me get patients, but it took me a full year, honestly, before I was filling out my clinic. It took me a full year for until maybe this June, July. I
Yeah.
was doing half days in clinic, and in the mornings I would help out my dad with his cases because I just didn't have the volume of patients. It's tough. um you mentioned, what is it like being a female urologist? Well, that's what it is. Being a young female surgeon in private practice is not easy. I have patients who come and see me
Why?
because they're like, "Oh, tan jovencita, you're so young," and immediately assume that I'm not experienced enough, or I don't know what I'm doing, or no, I need to see an older male surgeon.
I think that's the stigma, isn't it?
That exactly. So
Right.
it's difficult. So when I started out, sort of went like a traveling salesman, door to door to different, primary care facilities, other like community urologists, gave them my card, told them what I do. I'm a robotic surgeon. I am fellowship trained. I specialize in kidney and prostate cancer and ED and those sort of things.
But you also speak very well and you're very commanding. So like
Yeah,
people like, whoa, she's really smart. She
yeah,
knows
you
her
would
stuff.
think they would send me patients then, but they don't. All I get are recurrent UTIs coming through insurance. So the
And you
point,
think that's because you're a female?
it's because I'm a female, 100%. Why? Because, and here's another reason why. I my dad reached out to someone who refers a lot of patients to him to, just talk about a mutual patient, and then they ended up talking about me somehow. And the referring physician was like, "Oh, does your daughter treat, stones, for example?" Like, yes, she does. Oh, I didn't know that. What do you mean you didn't know that? I went to your office and told you exactly what I do. I went to all of these people's offices. I gave them my card. I told them
Right.
all of the things that I treat. But I don't think I'm being taken seriously as a young female urologist. And I told my dad that. My office manager was standing there in the background, like, yeah, she's right. She's right. You should listen to her. I met with we had a girls' date, me and, some other friends in the medical field. One of my co-residents graduated with me, Dr. Slivich, is a reconstructive urologist at Mount Sinai here in Miami. And we talked about how difficult it is being, taken seriously as
As
young
a
female
female.
surgeons.
Yeah.
People want to discredit our abilities because we are young and female. What ends up happening though is when these patients do come and see me, I take my time to explain things to them, which I don't think a lot of physicians do in Miami. I've come to realize a lot of my patients come to me completely in the dark about what's going on with them, how aggressive their cancer
Why
is,
do you think that is? Why do you
because
think
they
people
assume
are
their patients don't
uneducated?
know anything.
Right.
Truly, they treat like the culture of medicine in Miami, unfortunately, is, the patients are like cattle that need to be herded, is what I've
Is that
seen.
just a Miami thing,
Yes,
or is that
it's a Miami thing.
okay?
I can say that
So you're saying in New York it's not
it's
like
not
that?
like that. No, 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 no.
What's the difference
The
in New
I
York
mean,
and
patients are also asking questions, like, they want to know exactly what's going on with them. Patients here really put their trust and their health in the hands of their doctors, and I think the doctors sometimes, I don't wanna say take advantage, but it's obviously easier just to order the diagnostic test, do the surgery without explaining things. The patients they'll trust you like God. Patients here consider their surgeons and their physicians to be like God or close to God. So when patients come to me, I realize they're completely in the dark of what's going on with them.
yeah.
And I take the time because, again, I am very well read and I know, everything I need to know about urology. I can explain exactly what's going on, what they need to do, what are the treatment options, and then, the doubts in my abilities of being a young female urologist or surgeon, those go away very quickly because they realize, wow, she knows what she's talking about. Oh, wow, this is the first time a doctor has actually explained to me, how severe my cancer is or what my treatment options for my EDR or my Peyronie's disease or things like that. Um,
Yeah.
so, and then how that helps is patients then start talking to each other. Like now I'm seeing patients who told me, oh, yeah, you treated my so and so friend, you took out their prostate, they're doing great. He told me to come and see you. So that's how I've been building my practice now through word of mouth, through happy patients. But that takes time. Took me a year to
Hmm.
just get full clinics, like, morning and afternoon patients.
So you get a man comes into the office
Mhm.
with his girlfriend or his wife,
Mhm.
right? I mean, you see it all, right?
Yeah.
You're here in Miami.
Yes.
Let's say it's erectile dysfunction,
Okay.
right? What is that dynamic like? 'Cause you've got the wife or the girlfriend right there,
Yeah.
and he's like, I can't get it up. And you're a female
Yeah.
urologist. You're a female first, okay?
First and foremost,
First and
yeah.
foremost, you're female, then you're a urologist.
Yeah.
The wife or the girlfriend is there, or
Mhm.
maybe she's not there.
Mhm.
The man, as a man, just historically,
Mhm.
I probably would have never have talked to a female about that issue. I'd
Yeah.
talk to about it with a guy, be like, yeah, you got something so I can get it up or whatever it is, but
Right.
you're not going to say that normally
Yeah.
to a female. So what is that like?
So it's interesting that you asked that. Most of the time when I have to do a physical exam on a
Because men are
man,
so proud, right? Like,
of course,
especially
yeah.
with that.
But at the end of the day, it's a job for me, at
Yeah.
least. So when I have to do a physical exam, male physical exam, I hear this a lot. Me da pena, like I'm a little ashamed to show me, right? And I say, don't worry about it. It's literally my job. Don't worry. Like it's fine. And then I do the exam. I tell them exactly what I'm
You
seeing.
do the exam. They have to undress,
Yes.
right?
Yeah, yeah. I
You,
take them to, I mean, I do the exam away from the spouse or partner or whatever. It's just
so
me,
the spouse
patient.
doesn't go.
No, 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 no.
They don't get jealous, like, hey, why is this female urologist
No,
going to take the
because
exam?
thankfully they see me as a trustworthy person because
Okay.
again, I'm very by the
Yeah,
book.
you're
I'm very
you're
strict.
intense.
I can be intense.
Right.
But that inspires confidence in them. I'm not just, there to, gossip and have a good time, right? They
Right.
came to me because there's a medical concern. They either, came to me because a friend referred them or they went to my website and they saw that I treat this.
Yeah.
So they come to me and I'm in their insurance. That's another thing that helps. I'm in network. So they came to me with hopes. And I take that physician patient relationship very seriously. Like I want to, I don't want this to be a frivolous kind of relationship. So I say, okay, here are your risk factors. Here are the different options. Let me do a physical exam. And then, we'll excuse ourselves. We'll go into a separate room where we do the physical exam, a chaperoned physical exam, which also kind of, inspires some confidence, typically with another male chaperone so the
Right.
patient's comfortable. And I'm very forthright. I'm like, okay, this is how this feels like. Do you have any pain as I do this? Do you have any scars? How about this, and that? So it's not like I'm in silence and it's awkward. I have a conversation. So the patient also, again, takes charge of their health. That's a thing that I think is missing oftentimes in medicine in Miami because patients give so much of their care to the physician, they often don't take ownership of their own health, right? So I like to put that back into my patients. I want them to also be responsible for their health. I want them to be responsible for the physical exam. Like, you tell me, does this hurt? Is this where you're feeling the pain? Show me where are you feeling the lump, the bump, the nodule, the whatever it is. So I, engage in a dialogue even during the physical exam, and it's twofold. Not only does that help me understand the ailment or anatomy better, but also it distracts the patient from what would otherwise be an awkward exam. Like, I'm examining your penis and testicles. That's awkward, right? But if I start
Yes.
asking you questions like, show me, they're like, actually, if you do this, this, and that, it distracts them.
Right.
So it becomes less awkward that way. If you're just lying there in silence while you're messing around, that's not right. That becomes uncomfortable for everyone. So I like to engage my patients in discussion before the exam, during the exam, afterwards. I say, okay, here's what I found. You have an enlarged prostate, and afterwards, if the patient's okay with it, I discuss my findings with the spouse, partner, especially prostate exam. Like, they want to know, is it okay, doc? So I say, yeah, you've got a big prostate. It's a little bit irregular on this side, or I think I felt a nodule. Let's check a
So,
PSA. Let's get an
so
MRI.
talk about the prostate
Yeah.
because I think for a lot of men, you know, most guys in their 20s
Mm.
and 30s, they don't even know they have a prostate, right?
Yeah.
And then they hear, okay, well, you hear about, well, one in how many men have prostate cancer? Is it one in six?
Yes. So, like, 30, so the way it goes is prostate cancer is the second most common malignancy or cancer after lung cancer, right? Um
Can you die from prostate cancer?
Absolutely.
Okay.
30,000 thereabout men die each year in the United States from prostate cancer, which is too many, I think, especially since we have good screening for it. You know what I mean?
But what do you say to all the people that were like, well, there's a lot of data that shows that it's benign. You're not really going to die from prostate cancer. I'm not going to do anything.
So,
What do you think about that?
So I think that cancer screening exists for a reason, and it's not just limited to prostate cancer, whether it's colorectal, breast, prostate, pap smears, cervical cancer for women. The purpose of cancer screening is to overall not just decrease the burden on the healthcare system, which I think should always be secondary, but also to save lives. The
Right.
patient should always come first. So if we have cheap, non-invasive, readily available test to screen for different cancers, again, beyond the prostate. I think it behooves us as clinicians to offer that to our patients, explain the pros and cons, risks and benefits. So if I've got a man coming to see me, let's say it was for a kidney stone, and let's say they're 55, and I treat their stone,
Right.
they're coming to me for post-op, stent is out, they're feeling great. And I ask them, you're 55 years old. Have you ever checked a PSA? And oftentimes they say, what is that? And I explain what a PSA is. It's a blood test. It's a protein produced by the prostate. We use it for prostate cancer screening. Oh, doc, I've never had that. Do I need to do it? And I explain, I'm sorry. Could this be? Yeah, it's the hospital. What do I do now when the hospital is calling me?
You answer it.
I answer it. Okay.
So she's on call,
Yeah, I'm
like
on
most
call. Give me one
doctors.
second. Hello?
Are you good?
I'm good. Oh my,
So, all
sorry
right.
about that.
No. All right. So obviously we're talking about prostate
Prostate.
cancer, all these things, but let's totally shift
We're not going
gears.
to talk about prostates. Okay, it is Prostate Cancer Awareness
It
Month.
is. It is. And you
Everyone,
do
make
have to
sure you screen.
go get screened. Let's talk about something a little more fun. Because what do you do for fun, number one? Because you work a lot of
Oh
hours,
God, it's
obviously.
exhausting.
Right. So, we were just joking around. You're like, I'm ready to retire. Like,
Because here's the thing, you were before we started talking, you're like, after 1 year, but it's not been 1 year. It's been 1 year as an attending, but
right.
the road to becoming what I am, 4 years of medical school, 5 years of residency, 1 year of fellowship. So it was an actual decade of postgraduate. Like, after college, I had to study for another decade
Right.
just to have my first job. Like, residency, sure, it's a job, but it's still training. You're not independent. So when most people are starting their first jobs in their 20s, right, making real money, enjoying their 20s, so to speak, I'm still studying, I'm still taking
So
exams,
you had
I'm
no
still
life.
taking call. I had no life.
Right.
I'm like, this is my life right now, doing podcasts with you. This is recreation for me.
Right.
So that's why, I was jokingly saying that, I'm exhausted. It's really a grind to not just be a urologist, but medical field, surgery especially. You work long hours, and I know there's duty hour restrictions. We talk about the 80-hour work week for resident physicians. But sure, let's say that you are strict about that. Let's say that your program director is like, yes, go home. We don't want to,
Right.
violate any duty hours. You still have to study. There are still expectations to publish research. So it's not like you're completely off. You know what I mean?
Yeah.
So it's a lot of physical strain, a lot of mental strain, and now starting a life in your 30s is
I get stressed just hearing about
I know.
it's a
Yeah.
lot. So,
It's not for everybody. Let's
y-
just put it that way.
right. So, okay. So you're obviously you're now a urologist. You're in private
Yeah.
practice. You're working with your dad. You're on call.
Mhm.
You get a call in the ER. You've seen some crazy things, right? So, what? Tell me some of the crazy things you've seen
Yeah.
in the ER in the OR.
So it's you putting me on the spot. There's a lot of
Yes.
things. So urology covers the gamut of everything from the kidneys down, bladder, prostate, penis, all of that. So a common thing.
Let's talk about the penis.
Let's talk about the penis because
Yeah.
usually the most. That's always the thing that excites the ER the most.
Yeah.
Okay, the ER loves it when they have a penis consult,
Right.
because it's novel, it's new. It's like, oh my god, what do we do? So any sort of priapism, the ER is,
What's
so
priapism?
priapism is when you have a painful erection lasting more than 4 hours. Okay,
Is that because they took Viagra or
it's
Cialis?
so it's not typically due to those medications, it's typically an injectable or cocaine use. So I
Wait, so they did coke and
yes.
then they
Oh,
can't.
oh, I've seen patients who at like orgies or something do like a multi-drug cocktail, inject themselves with they don't even know what they're injecting themselves with, but their partner just gives them something to put in their penis and
They
then
actually inject
yes.
something into the
Yeah,
penis.
yeah, yeah. Yeah, yeah. I've seen this is not a
I'm
one-off. I've seen this multiple times. And then
okay.
they come to me
So they show up in the ER like full rager?
fully, yes, fully erect. And it's painful because it's been going on for 48 hours. Okay. They think it's going to go down. It's going to go down. It's fine. Once the drugs get out of my system, it'll go down. But it doesn't go down. And after a point, it's so painful because
Wait,
when you have an erection that long, like the blood supply, it starts to like, there's no more oxygen in there. Okay.
wait, I'm trying to paint the
Yeah, yeah,
picture.
yeah.
A guy in his 20s
Yes.
shows up in the ER at 3 in the morning with a
Raging erection.
huge, massive erection, or maybe
Yes.
not huge, depending on his size. He comes in and he's like,
Help me.
help.
Yes. Help.
Okay. So they bring him back,
Yeah.
they lay him on the table,
Yeah.
right? And everyone comes into the room, and
Again,
then
everyone's fascinated by these things.
and you're on call.
I'm on call. I
So
have to go
you're
in.
not there, you have to go
I
in.
have to go
So
in.
you could be 3 in the morning,
Yes.
right? You could be in bed sleeping, and they're
I'm
just
I'm
like, there's a
surely
guy
in
with a
bed. It's
huge
the
heart on. He can't won't go down. You need to
yeah.
come in and fix it.
Yes.
So you go into the hospital, and what do you do?
Yes. So I have to counsel the patient that, if you've had an erection this long, you're probably going to have permanent erectile dysfunction no matter what I do, realistically. So I need to set boundaries. Like I want to set realistic
So
expectations.
so he won't be able to get it up
Yeah.
again
Yes.
after.
Yes. If that
Okay.
long, because you totally mess up the mechanism of your erection, if you've been erect so long, no oxygen, it's bad. Don't stick things in your penis, please. So I explain, what the options are, and there's different things.
I
Eh,
can't believe people stick things in their penis.
People put a lot of things in their penis. A lot of
Like what?
things. A
Like
lot.
what?
Okay. So that's the priapism. And we can talk about how to bring down a priapism. That's usually a lecture I give to like residents and
Yeah,
ER
yeah.
people and
Right.
stuff. But moral of the story, it requires a lot of needles going into your penis to try to get all of that, old clotted blood out. So that's one
Wow.
thing. Another thing that I have seen, like people like to put things around their penis to
Oh,
get
this is the cock
the
ring
cock
story.
ring. Yeah,
Yeah.
not the story. Multiple. I've seen this
Okay.
multiple times.
Okay. Why would someone put a cock ring on
Because
their
it
penis?
it's so essentially keeps the erection longer. Okay, so you have an erection, you put a metallic ring around the penis,
Where do you put it?
you put it like penis
Just for
just around,
educational
just
purposes.
around.
I'm just asking.
If we had a banana, then I can do it.
And I'll
But
have a banana my next
next time we're
podcast.
gonna have a banana.
Right.
But you put a metal ring around it, so instead of detumescing or the erection going down, it remains upright because you're kind of constricting it. It's a constriction band. So
Okay.
you last longer in a way.
Okay.
The problem is you should take it out soon within a timely fashion. I've had patients who just leave it on. They're not actually having any pain. It's not painful, but over time, the it gets more edematous, the penis, and it reaches a
Edematous means what?
swollen. It
Swollen.
gets
Okay.
swollen.
Okay.
And it reaches a point where it's so swollen that the cock ring doesn't come off. You are strangulating your penis, truly.
Wow.
And the danger is if you strangulate your penis long enough, there's no venous outflow, there's no, lymphatic outflow. You're not getting inflow much either. So you're not getting good oxygenated blood either. Your penis could die. Okay. Like honestly, like
From wearing a cock ring.
from wearing a cock ring for, again, 2, 3 days. I've seen patients who come to me in the ER, like, I've had this on for a while now through the
Have you had
weekend.
to cut off
So the thing
or
about that
resect the
is,
penis?
no, thankfully all penises have been saved.
Okay.
But I tell them there is a risk that I won't be able to save this. It's cool, it's cold, it's blue, mottled. Like this is not what a penis is supposed to look like.
Right.
But to actually remove those rings, it's, like steel, stainless steel. So every time I've had to do that, we call the fire department. And I tell, so
Why
um,
why would you call the fire
because
department?
you need to get like a chainsaw. And that's not, no, truly, that's what you have to do. So you have to call, I
A
think,
chainsaw to put on the penis?
not on the ring.
On the ring.
Yeah, yeah, yeah.
Yeah, but chainsaws are massive. I'm
Exactly.
thinking of a big
So I don't
chainsaw.
even know if it's a chainsaw, but it's like the
It's like
tactical
a mini
response
chainsaw?
team. Yeah,
Okay.
it's the fire department tactical response team. It's the team that extracts people from like burning vehicles that have fallen off cliffs because they have all sorts of gizmos and gadgets to help with that. So it's some sort of rotary thing that you put on the metal, and so it's actually the firefighter who breaks the cock ring. My job as the urologist is to protect the penis from that because it gets hot. So you can cause burn injuries to the
So it's like
skin.
sparking.
It's sparking. So what happens is that this becomes a whole to do in the ER.
Right.
You've got this chainsaw, for lack of a better word, going on the metal. It's sparking. I am asking for cold irrigation fluid, like saline, whatever, and I'm pouring that on the penis to make sure that stays cool. And I'm sticking something, trying to get something underneath. I swear, if this is no, this is a spam call this time. Sorry about that. You never know when you're on call. And I'm sticking like a little popsicle stick or something wooden, something that won't, spark or won't transmit heat underneath the cock ring if I can get a little space so that when it finally breaks through the cock ring, it doesn't accidentally hit the penis. So it ends up being the firefighters who remove the cock ring, and I'm there just to protect the penis.
I will never wear a cock ring. I'm just
That's,
putting that
that
out
is wise. That is wise. So those are things that I have seen. And then people also like to stick things in their urethra.
of
Uh,
the penis.
yeah, so the urethra is your pee hole,
Right,
essentially.
right.
So
Why would you put something in your
I
urethra?
don't know.
What?
Boredom? I don't know if it's boredom.
What have you taken out of the urethra?
Um, so usually it's like a battery or a little cord or just something silly.
A
A
battery.
battery,
How
like a
do you
tiny.
fit a battery into a urethra?
I mean, it's something that you've been doing for a long time, so you've been
I thought
just
you were going to tell me
sequentially
like a
dilating.
coat hanger that they stuck in their penis. I mean,
I mean, if you've got like one of those metallic ones, I'm sure you can. You just take it apart, but I haven't taken that out. I read a news report once of someone who put like a cable, like your charging cable and whatever, into their urethra.
so here's an
Yeah,
off-topic question. So you're a physician, you
I
deal with penises, vaginas all day,
yeah,
but you also have to have a personal life, right?
yes,
You're married,
I am
right?
happily.
How does, as a doctor, how do you separate that? Because you've looked at penises all day.
Yes,
I, I
it's a job.
curious minds want to know.
It's a job. It is what it is. And one of the reasons why I married my husband is because he was fascinated by my job. W- w- Dating in New York was a pain, especially, brown guys from the Bay is what I used to call them back in the day,
What?
who I don't they're everyone who's in tech in California, brown guy,
Right.
Indian guy, thinks they're the coolest person ever. And is not impressed by anything that I do or
Right.
shows no interest in what I do. Like, okay, cool, I guess you're a surgeon. But Shubham, my husband, he when we first started going out, and he would ask me about the surgeries that I do, and I would send him little selfies from the OR, and he would see me
What would he
wear
think?
he would be very curious about my scrub cap. So he would go and get like a shower cap and put it on his head and send me a
Right.
selfie and be like, "Why do you look like this?" And I just thought that was so endearing that he wouldn't just write off what I do, that
Right.
he would actually try to ask me questions and engage and tell me cute little jokes.
Right.
But it's also like not just the robotic stuff that he knows about. He knows that I treat like erectile dysfunction. He knows that I,
Yeah,
put
you do prostate cancer, kidney cancer.
I do,
You
yeah,
do.
but and
Yeah, you do serious stuff.
yeah, 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 I do serious stuff, and I also do like you were asking about the penises and the vaginas and all of that. Like, does Shubham mind? Absolutely not, because he knows that it's a job, and he
Right.
knows that I take my job seriously. And okay, that's the interventional radiologist calling. I'll call him back. Um, so um,
That's a radiologist that does interventional procedures, in
Yes, this
case
is
anyone's wondering.
regarding a consult, so I need to
Yeah.
call him back. So, but just to finish the point about Shubham, who is a darling husband, he knows that I take my job seriously and I do good work for my patients. I'm a good surgeon.
Yeah.
So, whether I am taking out a kidney tumor or if I'm putting in a bombita, an implant in a penis, he knows that I'm the right surgeon for it. So he's like, "You do it. Of course you should do it." And he always asks me how my cases go. And if something doesn't go well, or I say, "Oh, this happened," he asks me more questions about it. He's not a doctor, he's a consultant. He knows nothing about medicine, but he wants to understand what I do. So it's never been a problem, me being a urologist. Um, to me, to Shubham, it's just a job.
Do you want to have kids?
Yes, at some point I would. Ideally, after I take my oral boards, which I'm currently studying for.
So for your board certification.
Hmm.
Okay. So
Am I allowed to answer this real quick?
um
Am I allowed to? Yeah, only because it's about.
no, no, do it. I mean, patients first.
Yeah, yeah, yeah. Okay, let me call.
This is a fun podcast.
Is
That's
this?
that's more important. So, I mean, obviously, you're an amazing surgeon. You're passionate about what you do.
Yes.
You're just starting your career, but man, having known you for several years now, you are you are what I call a workhorse. I mean, you outwork most
Mhm,
people that I've seen that are doctors, and I know a lot of doctors and
mhm,
surgeons. That's a breath of fresh air because a lot of surgeons are just kind of going through the motions, getting a paycheck every 2 weeks, and you actually, I mean, this is your life. You do this,
clearly.
so I mean, you can just hear it on call. So, I mean, obviously, if you're a patient and you need any kind of urological care, why don't you give a little plug
Mhm.
for uh, for Miami Robotic Surgery?
Okay, so sorry about the multiple interruptions. Like I said, I'm on call and, I have to sometimes drop knowledge on people when I'm on call. I Miami Robotic Surgery, it's based out of Doral, Florida. It's a practice that I have with my dad, Dr. Sanjay Razdan, who is the director of the International Robotic Institute for Prostate Cancer. And together we provide comprehensive urologic care for our patients, patients with cancer, whether it's kidney, bladder, prostate, and also benign conditions, like benign meaning non-cancerous. So erectile dysfunction, enlarged prostate, urinary incontinence. We see men and women. Uh, and we're happy to take care of everyone and provide evidence-based care, whether it's medical, surgical. If our patients do need surgery, we use the latest technologies, latest lasers, robots, whatever it takes.
And you have patients from all over the world that come to you guys, right?
Yes,
Yeah.
all over the world, out of state, out of country. They come seeking us out because,
I did a search. I looked up best kidney cancer surgeon in the world, and you showed up.
yay, oh, that's good. Now this is a toll-free call, so I know I don't have to answer that. Um, so that's great news. So thank you for that. And at the end of the day, we just want to be able to provide the right care for our patients. That's evidence-based, that allows the patients to also take charge of their health. It's an important relationship, I believe, the physician-patient relationship. It's one that I do not take lightly, and I'm happy to continue practicing here. And I if you ever need a urologist and you're in South Florida or out of state or whatever, please you can look me up, Dr. Shirin Razdan, or you can call our office 305-468-3314, and I'm happy to take care of you.
And what's your website?
Oh, my website is miamiroboticsurgery.com.
All
Can't
right.
miss it.
All right. All right, folks. Well, that's all the time for today. And thank you,
Oh,
Dr. Razdan.
okay.
And
What?
yeah, time flies when they're having
We
fun.
need to have a part two.
We will have
We'll
a
do a
part two.
part two with the father-daughter duo, I
I would
think.
love to do one with
That
your
would be
dad.
insane.
That'll be a dynamic
Yeah, yeah, yeah. I
conversation.
think so.
So, and we'll who knows what we'll talk about then. So anyway,
Truly.
thanks everybody, and
Thank
have a
you.
good night.